What is congestive heart failure, CHF, and how does it relate to sleep-disordered breathing? CHF is a complex clinical syndrome that arises from virtually any cardiac disorder that hampers the heart's ability to fill with or eject blood. This can result in two types of heart failure, forward and backward. Forward heart failure occurs when the heart can't maintain adequate cardiac output to meet demand, or can only do so by increasing filling pressure. On the other hand, backward heart failure happens when the heart can't handle venous return, leading to elevated filling pressures and vascular congestion. This heart failure can affect the left side, the right side, or both sides of the heart, and it can involve components of ineffective ventricular filling and/or contraction. While most cases are linked with poor cardiac output, some CHF cases aren't due to inherent heart disease, but are instead due to increased demand. Now that we understand what CHF is, let's explore its relation with sleep-disordered breathing. So, how does CHF relate to sleep-disordered breathing? Let's dive right in. Sleep disturbances, including Cheney-Stokes breathing and sleep apnea, are quite prevalent among patients suffering from congestive heart failure or CHF. In fact, nearly half to more than half of these patients experience these disturbances. Now, why is this significant? Well, these disturbances are associated with a worse prognosis and greater left ventricular dysfunction. In simpler terms, they can make the heart condition more severe and more difficult to manage. But there's a silver lining. Nasal continuous positive airway pressure, or CPAP for short, has proven to be effective in treating Cheney-Stokes breathing and sleep apnea. It leads to an improvement in cardiac function and symptoms, providing some much-needed relief to patients. Understanding the link between CHF and sleep-disordered breathing can help in better managing these conditions and improving the quality of life for those affected.